and the skeletal system are put together. But I think they're two big systems and they're quite heavy. So I don't think I'm going to do the two. Okay, so we're going to look at the bones and the joints, the skeletal system. And then in our next session, we can look at the muscular system. So again, the skeletal system is very important to us as human beings and to us as therapists. Whatever level therapy we're doing, we will be working with the skeletal system. Okay, whether we're doing level 2s on luxury facial, level 3 on electric facial, manicure, pedicure, body massage, even waxing, even though we're not going to wax the bones, but even waxing in the area that we're waxing. So it's quite important that we know the joints and the bones of the body. So we're going to look at the skeleton this week, the different types of joints and the ligaments. The ligaments are what join the joints up, yes, so that we can move and we're not stiff. Okay, so the most common joints are freely movable and are called synovial joints. These are loosely held together by a form of connective tissue called ligament. Okay, the most common joints, they move freely, synovial joints, and they are loosely held together by a form of connective tissue called ligament. Now, if we damage, so we fall and we break a bone, it will take us a good 6 to 8 weeks for that bone to heal. But once it's healed, if it's not damaged too badly, we're good to go. Yes, it's usually okay. Sometimes, if it's a very bad break, we then will have to put pins and things to hold it together. But once that's done, that bone is usually quite stable. If you damage a ligament, yes, connective tissue, that is going to take you at least 3 times as long to heal. So sometimes the doctor will say to you, it's better that you had broken that bone than damaged that ligament. The ligaments are like, I've got one that's not broken this time, guys. So they're like elastic bands, and loose elastic bands, and that means they can snap. Yes, they can overstretch. Okay, but if you think this is my joint and that's my joint, this is joining it together very loosely. Okay, so it's like an elastic band. So let's look at the different types of joints that we have. We have a joint called the ball and socket. That's the ball, that's the socket. Okay, so it can move in. And this is basically found the hips and the shoulders. So a ball and socket can go all the way round. You can do your hips all the way round. I'm not going to stand up and do a little dance, but you can do your hips all the way round, and you can do your shoulders all the way round. So ball and socket can move like that. Then we have something called a hinge joint. So a hinge, up and down. And this is found in the knee and the elbow. Yes, open and close, like a door. Up and down or open and close. Hinge joints. We have a pivot joint, and that's found in the forearm. I'm trying to get my arm, and it can still spin, but it can't do a whole 360. Then we've got another hinge, which is your ankle. Can't get my foot all the way up there, guys, but the ankle up and down, so you can do your ankles up and down. Okay. Canoid joint is your wrist. Yes. Now that can do a 360, but I'm going to come back to that. It's not a ball and socket. Then you also have a gliding joint where it slides on top of each other. Okay, the foot. Okay, so our wrist. Why do you think the wrist is not a 360? Because it is not two joints together. It is several joints. Yes, that makes it do that 360. So that's the thing to remember. Because even our foot, if we rotate our foot, it can do a 360, can't it? But it's not a ball and socket. It's not sitting. Yes, it's not doing that whole, just two joints making that whole circle. It's more than one joint that enables us to do that 360 movement. Okay, so those are all the joints we have in the body, scattered around the place. Nope, there's some more. We spoke about no, these are the same. The gliding joints found in the hands, a gliding joint. The joints slightly go over the top of each other, very slightly. Yes? So they don't just meet like that or go like that or in a hinge. They slightly go on top of each other. Then you've got the toe, which is a hinge. Yeah? Toe can go up and down. And your finger, which is a hinge joint. Okay? So we've got those different joints. Let's go back. We've got the hinge, we've got the ball and socket, we've got the pivot, the conoid, and the gliding. Okay. So let's look at our bones. We've got bones of the spine. We have bones of the neck, we have bones of the arms. Now, bones of the spine, again, quite important, because if we didn't have bones on the spine, we'd be falling over like this, wouldn't we, guys? Yes. It helps to keep us upright, helps, because the muscles keep us up well. So the bones of the spine, there are seven clavicle bones. These are located in the neck and upper back. Thoracic bones, there are 12. This is the upper and middle back. Lumbar bones, there are 5, placed in the lower back. Sacrum, there are also 5. These are the base of the spine, and the coccyx bones, there's 4 of them, on the tail of the spine. Now, this is quite important to remember where these are located, because you may need to, at some point, there may be a question asking you, it would say, so I have clavicle bones and they're found in the neck and upper shoulder. How many is there? Yes? So this little diagram that we've got here is a nice, simple way to remember. It's the name of the bone, number of the bones, and where they are. Okay? And then we've got a lovely little picture here. Let's make that one a little bigger, and so we can have a look where they're actually located. Okay, yeah, so clavicle, the 7 bones, the thoracic bones, the lumbar bones, sacrum, they're fused. When we say fused, if you look at the thoracic bones, they're not joined together. Can you see their little bones just sitting on top of it? As we go down to the sacrum, there's no spaces. Can you see higher up, thoracic, lumbar, there's spaces? But as you go down to the sacrum, the bones are fused, and the coccyx bones are fused as well. Yes? So anything under the area are fused. They're all joined together, almost making one bone. I've been eating toffees, guys. Can't get the words out. Okay, important to us as therapists, the bones of the head. And let me just make this tiny bit smaller so we can get the whole there. So the bones of the head. Whatever level you're doing, you will need to know the bones of the head. The bones which form the head are known as the skull. Okay, so the whole area is known as the skull. But the skull itself is divided into 2 parts, the face and the cranium. Okay, so everything joined together is skull, but the skull is divided into two, the face and the cranium. Together, there are 22 bones of the head, 14 bones of the face, and 8 bones of the cranium. And here they are, the facial bones and the cranium bones. And as therapists, it is a very good idea to know the names. You will never really have to say these. I am actually going to be working on your mandible bone or your nasal bone, yes, to your clients, but you as a therapist should have in your mind what bone you're working on, yes? Doesn't matter that there's 2 or 3, you need to know. And as you go up in level as a therapist, so you started off level 2 and you're just working massaging over these bones, you may go up to something like level 4 and you may be doing, I don't know, injectables, aesthetics, yes? You still need to know your bones and your muscles underneath. So it's important you do actually study your bones and your muscles. You don't have to say them out. You just need to know them. Isn't that good that you don't have to say them? Thumbs up. Occipital, temporal, sphenoid. Yes? So you don't have to actually say them. You just have to know how many and where they are. So that's a good thing. Okay. So let's look at our little picture so we can actually see where they are. Okay, a little bit. Okay, let's come in. Right, okay. So on my left-hand side, I hope there's a picture of the skulls with the little wavy lines. Can you see the little wavy lines? And those wavy lines are called sutures, just like stitches. Those were when the person was a fetus or a baby. Obviously, they have to be born and their head is like the size of a melon. Not to put anybody off who had children, but it is. And it's coming out of a hole the size of a grape. Okay, luckily, that hole can stretch. But to aid with the head coming down the birth canal and actually being born, our bones are not as hard as they are now. Yes? So if you've seen a newborn baby, their heads are really soft. There's a little area where the bones have not joined up. You can actually, sometimes when they get very upset, you can actually see the brain moving, yes, pulsating. And that's because the head had to come down the birth canal and our bones are not solid, so they slide. So actually the head shrinks slightly so it can come down the birth canal. You'll see some babies have very weird shaped heads because they've had to change the shape to actually come out. And some babies have to use forceps to actually take them out. Yes, and you'll see the head shape will change. At the age of about 1.5, the bones start to fuse together. Yes, so they start to become quite strong. And this is where you get those little lines, the sutures is where the bone has fused together to become hard and to protect the brain. Okay, so those are sutures there. So we've got 14 facial bones. They've got the matic bone, I call that, and that is the cheekbone. Can you see how thin it is? Quite easy to break, especially just back here above the jaw. Yeah, so a punch or a hard hit can actually break your jawbone. Okay. And then you have got the palatine, which is just at the back of the skull. You can feel that little bump yourself. Yeah, just here. The nasal, there's 2 nasal, lacrimal, that's the eye, the top of the eye, the inside of the eye. The nasal, the nose, not this bit of the nose. If you feel your nose like that, you see it can move around. That's because it's all cartilage. yes? But underneath at the top, just here with the bridges, it's hard. Yeah, that's the nasal bone. So it's one on either side. The vomer, which is just above the mouth, the maxilla, which is the top area where our teeth are, and the mandible, the bottom, holding our teeth in place. Okay? And where it says two, it's because the maxilla splits in half, one that side, one that side. But the mandible is one single jaw bone. Okay, brilliant. So then we can move on to the bones of the neck, chest, and shoulders. Again, as therapists, these are quite important to us because we work on those areas, yes, especially with our massage. There are 15 bones in total. Okay, so there are 15 of them. You have one sternum, which is the chest bone. Bless you. Chest bone in the middle. That's what we can hit. Now, if we're having heart surgery, for them to get to our heart, and this is sounding terrible, but they actually break that bone. They don't saw it, they actually have a hammer and they crack open that bone so they actually can get to your heart. And then what they do, they wire it back together again. Okay, so that's the sternum, just one. The humerus bone there's two of them, and they're the arm from the shoulder to the elbow. Shoulder to elbow. And you know, sometimes when we knock our elbow, we get that funny sensation. Yeah, so they call that the funny bone. That's the end of the humerus bone. Humerus bone. Okay, so that's joined there. Okay, then we have scapula. There's two scapulas, and they are shoulder blades at the back. Two shoulder blades. Okay. And then the clavicle. The clavicle is the collarbone that we can feel. That is a very thin bone, very easily broken. It's one of the easiest bones to break. And you can feel how thin it is. Yeah, so very easily broken. The hyoid bone is a little bone which is at the top, which is just between at the bottom of our neck here. When there are murder cases and they suspect that the person has been strangled, 9 out of 10 times they will look to see if that bone has been broken. It's a very small bone. And through the squeezing, you can break that bone also. Okay, hyoid bone, that's one of them. And then you have the clavicle vertebrae. The clavicle vertebrae is the bones that are coming to the back to make the vertebral column. You know, the bones that come right down to make your backbones. That's the ones that we saw the little gaps in between. Yes, so they're not fused because obviously I've got to be going backwards and forwards and moving up and down. So it's not good to have it fused because I'm very rigid. I'd be moving almost like that. Yeah. So it gives us our movements as well as our muscles. Brilliant. Okay. So, bones of the hand and the forearm. Again, manicure, pedicure. Yes, we need to know. It's important that we do know. I'm just going to make that picture a tiny bit bigger. If not, I will come back to it once. Yeah, I'm going to come back to it, guys. I'll make it bigger once we've done them. So there are 8 wrist bones. And those wrist bones, and you're going to be very happy again, you're not going to ever have to say those bones out, okay? But those are 8 bones, and all those bones together make our relatively the carpals, okay? Carpals, which is much easier for you. But then somebody in a test might say, it's a scaphoid, a wrist bone or not. So you need to know the names of them. Yeah, make sure that you know it is a wrist bone or a carpal. Then we have 5 hand bones, and these are called metacarpals. I'm going to make that picture bigger so we can have a look exactly where they are. but 5 hand bones called metacarpals. They're here. So you've got the wrists, then you've got the metacarpals, which are here. Then we have the finger bones, which are called phalanges. So carpals, metacarpals, phalanges. And then the 3 bones of the arms that we looked at, remember the humerus from shoulder to elbow, the radius and the ulna. The ulna is the thinner bone, the radius is the thicker bone. Okay, let's have a look at this picture, make it a little bit bigger so we can actually see. It's not a great picture because it's on the end. Right, so you can see all the bones of the wrist, yes, the 8 bones of the wrist. Then you can see first metacarpals, yes, so these ones here, metacarpals. These ones go up to here, yes, so where our knuckles are. After our knuckles, these are phalanges or fingers. The phalanges are separated, you can feel them into 3, 1, 2, and 3. You can feel where the joints are. So the phalanges are separated into 3 separate areas. Okay. All right, let's make you smaller. And we look at the feet. So there are 7 ankle bones called tarsals. So we had wrist bones, carpals. Ankle bones are tarsals. Remember C, like toes. Yes? Tarsals. We have 5 bones of the foot, okay, which you can feel here, ankle to the bottom of the toes, and they are called metatarsals. I say it's very similar to the hands, aren't they? Metacarpals, metatarsals. Then there are 14 toe bones. Again, can you see they're separated into 3? Yes? They are also called phalanges. 14 toe bones, also called phalanges. And then there are 2 lower bones of the leg, fibula and fibula. Fibula is the fat one, F for fat, fibula, T for thin. Fibula and tibula, or tibia. Okay. So I don't really want to go into that. Right, so I'd like us to unmute, please. Everybody unmute so we can have a little conversation. Bear with me. Okay, everybody on unmute, well done. Now, yes, first of all, my first question to you ladies are there any questions on the bones? Let's start with joints. Is everybody clear about the bones?
Yes.
Yeah, just give us nice hands up. Yeah, you can speak to me. Everybody happy about joints? Yeah? Okay, so we had various joints and we know what they're doing and sliding and etc. Right, well done. What about our bones? Are we happy about our bones?
Yes.
Yeah? Nice, easy. Yeah, that was a nice, easy breakdown. When you look in your book, sometimes the bones go into what the bones are made of inside, you know, where the how they heal, etc. But I think this is what you know about the bones.
Yeah.
The main thing that we need to remember, how many, yes, where they are, then their names. That we don't ever, because a lot of people shy away from learning because they're saying, I can't say these names. Yes? You're not going to have to say them. You just need to know where they are. Are they an ankle bone? Are they a finger bone? Are they shoulder bone? Are they? Yes? That's all we need to know. Any questions, ladies?
No.
Anything you would like to ask me? No? Everybody happy on that?
Yeah.
I'm going to go to my other page, make sure my ladies are happy on that page. Holly, everybody happy? Yes? Great.
Yeah.
Perfect, always. Okay, so are we ready to go our little quiz?
Yes, let's go.
Yes, now I'm going to make a little confession. I was going to write out my quiz questions, but I was having a nice talk with Sabrina and I haven't done it. So this is going to test me as well as testing you, because I've got to remember what I'm going to ask you and if the answer is true or false. So just to remind everybody who hasn't done our quiz before, you will have your paper. I will ask a question. You will hold up and you will have either a T for true or an F for false. Yeah, we all happy?
Yeah.
Good, good, good. Right. Okay. Let's go. Oh, if I go back there, you're going to see it. Okay, you might not. Okay. So we started off, ladies, with joints. Now this one, we're going to move off slightly from true to false. I want you to remember. Can you remember how many different joints we have? Just write a number. So try and think back. How many different joints we have?
2.
Lovely. Okay. Got a nice one there. Yeah. Just hold up to me. Guess, darling. Don't worry. Just guess. How many do you think we have? 2, 3, 1.
2.
Yeah. Okay. Lovely. Holly.